Partnered by Time's Influence.
Becoming a mother is a joyous moment. And this special bond between the mother and the child is priceless. From the first step that a child takes to every stage of growing old, the mother is the primary caregiver and in a unique position of influencing her child's health.
The best thing in any woman's life, the most difficult job in the world, because yes, people are with different attitudes, with different professions, but I think motherhood or being a mother is the most challenging job in the world.
Being a parent is like, it's a mixed of, it's a roller coaster ride. It's more of like something like you want to go back to because it's so thrilling and the rush is so good.
And the first step to nutrition is the mother's feed. Breastfeeding is one of the most valuable gifts a mother can give to her baby, the best source of nourishment for infants and young children. The breast milk contains antibodies that can help your baby fight off diseases, leading to a lifetime of good health.
We talk about breastfeeding and then we don't understand the concept, because sustained breastfeeding is very important for the mother, because most of the times in India, statistics also say that they drop off after initial few days or few weeks.
The most natural method of ensuring that your baby gets the optimum nutrition at any given point. In addition to this, breast milk has got something which is not replaceable in any other form of feeds in any part of the world, and that is the natural immunoglobulins, or the material in the milk which helps in the immunity of the baby. It prevents the baby from getting infections, and this cannot be replaced artificially by any means in any form of food that can be given to the baby. So more importantly, other than the nutritional part of it, it also helps in promoting the bonding between the mother and the child, which I think is the most beautiful part of breastfeeding, and that again cannot be replaced by anything else in the world.
It is supposed to be the perfect thing for the early newborn, right from the age of newborn. It is provided to us whenever the child requires it, demands it. It is provided at the absolutely right temperature. It is already warmed up. It has got the best of the calories that is required for a normal human growth. It has got the right protein amounts. It has got what we call as the whey-casein ratio, which is best utilized by the body to grow up. It does not need anything else. 60% of breast milk is already water, so they don't need to drink any more water. They're already their thirst is quenched up.
A journey from a baby to a toddler involves the development of all the aspects, including the EQ and the IQ of the child.
We'll make a ball with this robot.
And among many factors that build a child's IQ, providing the baby exclusively with breast milk is of utmost importance.
Well, there are some things in the breast milk, in the human breast milk, which are so very different from the milk which the cow produces for that particular species. So a calf, for example, needs to drink her mother's milk, the cow's milk, to get larger in size faster, okay, because the cow's milk is about gaining body. Whereas human breast milk has so many advantages about the brain sustenance and improving the quality of the IQ the child would have it, and that is why it is important that we need to promote species specific breastfeeding.
For a long period of time, whatever the studies have been done on neurodevelopment and how better the IQ is, most of the studies that came out from the West were up till 4 months of exclusive breastfeeding, and it showed a straight away 15 to 20 points IQ difference at 18 years of age between kids who were exclusively breastfed till 4 months and kids who were mixed fed or not breastfed at all.
Harsha Vaswani Mittal, mother of an 8-year-old baby boy, is enjoying her new journey as a mother as she attributes breastfeeding as one of the most important reasons for it. She loves the bond that she has developed with her bundle of joy by providing him the best nutrition possible.
From the first latch itself till now, it's been a beautiful journey. Breastfeeding is not easy though. It comes with a lot of challenges. Like initially you have to feed your baby every 2 hours, which is like 12 hours in a day. It is definitely really crazy and a lot of hard work. But if you can do it, you will see its rewards. It's very rewarding also. And just to have that feeling that you are feeding the baby and he is surviving on your, you are nourishing him and yourself without any external help, it's a big deal.
But the picture currently is not as pretty. According to a UNICEF India report, only 25% of newborns are put to the breast within 1 hour of birth, and less than half the children below 6 months are exclusively breastfed.
One of the important reasons for not the rate of breastfeeding not very high in the general population, some of the reasons are one, the lack of awareness. Second is some of them if they are delivered at home, and there are a lot of cultural practices which prevent them from going to breastfeeding. Some of them is throwing the colostrum. So colostrum is thrown, and whereas it is the best thing which the baby can get on the first 1-2 days of life.
You can breastfeed the baby however long you want to. There's no hard and fast rule that you have to stop the breastfeeding at some particular point of view. The minimum period, a good period for a mother to breastfeed the baby would be 1 year. Most studies have shown that a minimum period of 6 months of exclusive breastfeeding is good for the babies, and this has got all the benefits in terms of providing good immunity to the baby, decreasing allergies later on in life, as well as improving the mental IQ of the baby over a period of time.
Apart from the lack of awareness amongst families, there are numerous myths which act as barriers to breastfeeding in India. These myths lead to confusion and uncertainty about the right way to breastfeed and how long the baby should be feeding.
At the time of birth, the mothers feel that there is a lot of pain, so breastfeeding should not be done. So they should be given adequate rest. But in fact, babies, if the mother starts breastfeeding, a bleeding is going to come down. Oxytocin, which is a hormone which gets released when the babies are breastfeeding, it comes in a pulsatile form, and which will give a lot of comfort to the mothers, not only in relieving pain but also in relieving anxiety. So pain should not be the indication for not breastfeeding. Second thing is, most people feel that the first milk which comes, which is called colostrum, and it's thrown off because it's thick and watery. So this milk should never be thrown off. It has the best nutrient content, it has the best immune factors which can protect the baby from all infections. So nobody should throw off colostrum. If the baby is born premature, the mother should ensure that her colostrum goes to the baby on the first day itself. And if it's a mature term baby, the baby should be put onto the breast, and that colostrum should always be given to the baby.
Some people would, the concern is that the breast milk is not enough in the initial phase, because the milk is not coming for most mothers in the first 2 or 3 days. They feel, okay, we need to give something, because the baby is crying. One has to understand that the baby's stomach is very small, like on the first day, something like a small lemon, and so the amount of milk is lesser, is enough to fill up that small lemon. So eventually, over next 2 or 3 days, the size of the stomach becomes a little bigger, to the size of a small orange, for example. And by the time the breast milk input also increases, so you don't need to start with other feeds. So this is one of the common problems.
Keeping these factors in mind, it is imperative to spread awareness about not only the benefits of breastfeeding, but also the need for prolonged breastfeeding. And with that objective, we celebrate the World Breastfeeding Week in the first week of August every year to encourage mothers to be a part of this cause.
Breastfeeding Week, which is there for 1 week, is a phenomenal activity. I mean, it really highlights the need for it, but in my view, it should be 365 days a year.
This is a subject which is taboo. You don't talk about it. You don't openly educate a mother. You don't openly educate a woman saying that, if you can't breastfeed, there are solutions available which can help you to breastfeed your baby. The problem is that the amount of education that has been done, the amount of awareness that has been done is minimalistic.
We are also working on the adolescents to help them, to prepare them for better nutrition and health, so that when they are future mothers, they are better prepared to be. That brings a continuum of care kind of a phenomena that you work through a life course kind of process, and that helps in better outcome for mothers to breastfeed their babies when you're already knowledgeable and understanding about the values of the pregnancy care and the newborn.
Time for a quick breather. On the other side, we bring to you the importance of antenatal sessions and easy and handy solutions for working mothers to breastfeed their babies.